reasons that that is they're surviving heart attacks, but they might end up with damage to their heart muscle afterwards. There's also issues with valves. So the valves are like kind of gates keeping the flow of blood going forward. And if those valves or gates aren't working right, the blood flow comes back, and that's like a backlog as well. And 1 in 5 of us in our lifetime is going to actually develop heart failure, which is quite a lot. And being kind of left untreated, that the people, and the important bit here is being left untreated. Heart failure deaths are second only to that of lung cancer. So that's what I want to aim in on tonight, is about getting early intervention if you think that your symptoms of heart failure are deteriorating. So as I was saying at the start, we use every resource that we have to keep ourselves well, but we have to remember this takes a whole team of people to do it. And who's on the team is yourself, the patient, your family, the GP, the pharmacist or the chemist, the heart failure nurse, your cardiologist, the palliative care team, the cardiac rehab, the dietitian, psychologist, and organisations in like the Irish Heart Foundation. Some of you might have met everybody on the team. Some of you mightn't have all these people available to you on the team. And the people who, like we say, the psychologist, at the moment, there's only one up in Dublin that's on a heart failure team. Dietitian, there was one in Dublin, and now we've actually got one in Waterford as well, who's seeing people actually at the moment up in the Dungarvan area for us. Cardiac rehab is the place there then where you go to for your exercise at the moment because of COVID. COVID's after causing havoc with our health system, but because of social distancing, a lot of cardiac rehab centres unfortunately aren't up and running at the moment, but they are ringing people and giving advice about exercise, which is very important. And I'll go through that a little bit later. Our palliative care team is a very important part of the team. And usually people associate palliative care with end of life and dying. But palliative care does far more than just looking after people at end of life. They're actually specialists in people looking after people who've got symptoms that other teams are finding hard to manage. And that's not for the heart failure team, it's for the respiratory team, the diabetic team, all teams. So if we have a patient and we're struggling with some symptoms, the palliative care, we ask our colleagues maybe to help with breathing difficulties, if there was anxiety, and they give us their expertise. And then when the symptoms resolve, they pull out of the care at the moment again. So people come in and out of your team as you need them. They're not in there all the time. Like the cardiologist, you might be seeing him once a year, you might be seeing him more frequently or less frequently, as is with the heart failure nurse as well. The chemist is a very important part of the team, and I advise anybody when you're getting over-the-counter medication, keep going to the same chemist. That chemist knows exactly what medication you're on, and that if you want to get over-the-counter tonics or anything like that, anything extra that you take might interfere with your medication. So we need it from the same chemist so he'll know if there's any interactions. The GP, and I hope that you're all going getting your flu vaccines at this year. Out of all the years, is so important to get your flu vaccine this year. And it's not just for yourselves, it's also your family, because if a member of your family gets it, then that they become at risk maybe of giving it. So everybody, I've advised all my own family and extended members of my family to all get the flu vaccine this year. Your family, I can't even say to you how important that is. You be telling me that in clinic how important the family is. As I said, it's a team effort, and yourself. So out of that whole team, we just work out now who's the most important person on the team, and don't all shout now the heart failure nurse. So it's you. You're the most important person on the team. You're the person who's the only person who's able to take control of your own health. Nobody else is able to do it for you except yourself. And as you know, this takes daily action. Some days you're fed up of having to do this and you're just having a bad day. That's okay. We all have bad days and they're acceptable. And you just acknowledge this is a bad day, but tomorrow is another day. So it's daily action. It's really important to recognize the symptoms of heart failure. When you don't recognize the symptoms of heart failure and the symptoms worsen, basically what's happening is the fluid is building up inside in your body, and that's putting a pressure on your heart, as in the fluid is building up behind as well. So we want to relieve that pressure on your heart. Sometimes if you leave it too long, how well it was pumping beforehand might be hard to achieve that back again. So the earlier you can get intervention, the better. Sometimes I hear people saying, look, I hate ringing you when they be ringing in, but we never mind anybody ringing. We actually would prefer if somebody rang and it was just having a chat for 5 minutes and there was nothing actually wrong at all, then we actually missing the fluid building up. So the symptoms of heart failure are, if you're starting to feel shortness of breath, if you feel that the jobs that you're doing every day, you're getting a bit more breathless trying to do it. And this is where the family comes in. The family actually recognizes this faster than what you will yourself. So they might say to you, God, are you getting a little bit more breathless trying to do that? The next thing is any swelling in your ankles. So when the fluid seeps down through the body, your ankles will start swelling. And just check for ankle swelling in the morning. That during the day, if it's a hot day, all our ankles will swell. So it's in the morning when you're getting up and you're checking, how is my ankles today? And sometimes people can actually get swelling around their tummy so that their fluid is congesting around their gut. And this is recognized by that suddenly your trousers or your skirt is getting very tight. So that might be a sign that the fluid is gathering there. And if it is, maybe your tablets aren't being as well absorbed because you've got fluid in your tummy as well. So the tablets are finding it hard to get through that fluid. Also, any activity intolerance. So what you're doing, you're finding it harder to do. So that's another sign. Loss of appetite, and that goes back to having some fluid in your tummy. You're having this full feeling all the time. And if somebody presents you then with kind of a large meal, you actually couldn't hardly look at it. You'd actually feel ill looking at it. So that's a sign that there could be fluid gathering in your tummy. And extra tiredness. If we all had to be carrying around extra fluid all day, so if we all had to be carrying around a couple of litres bottles, we're tired. So if you feel that when you sit down and next thing you're gone to sleep, that could be a sign that there's fluid gathering. Difficulty in going to sleep, or suddenly waking up feeling you can't breathe. Now this happens after about an hour or two of going to sleep. I should have had my little water bottle with me, but basically your lungs are like a bottle standing upright with the fluid at the bottom. And if you put a bottle down flat on its side, do you know the way the water goes all over the side of a bottle then? Your lungs are exactly the same. So when you lie down in bed, slowly the fluid will level over the whole surface of your lungs and you suddenly wake up feeling, I feel as if I'm suffocating. Those of you who suffer from breathing difficulties, it's a slightly different sensation. With breathing difficulties, it's hard to get my breath in, but with fluid, it's like as if I'm suffocating, and it happens about an hour or two after falling asleep. So if that happens, you have to ring your GP or you ring your nurse first thing in the morning. Sitting upright will relieve it because the fluid will seep back down to the base of your lungs again. And sudden weight gain. It's so important to do your weight every morning. And the importance of that is that's our first sign usually that fluid is beginning to gather. So when fluid is beginning to build up inside in your body, your weight is suddenly increasing. So sometimes that people say, sure, I'm the same weight every day and should I have to be doing it every day? You do, because it might change. It might never change, and that's a wonderful thing. But I always think if you can incorporate what you're doing into daily life. So in the morning when you get up, you have to go to the toilet anyway. So when you're out at the toilet and you've gone to the toilet, it won't take 2 seconds to hop up on the weighing scales and just take, if you like, it become a habit, and a habit takes effect after 2 weeks. So it's so important to then inform someone if that rise in weight happens. And I'll go into how much of a weight rise we want now in the minute. So what do I do if I begin to have symptoms? As I said, you ring your heart failure nurse, you ring your doctor as soon as possible. Sometimes people who are already attending heart failure clinics, you might have a plan that the nurse might have said, look, if your weight goes up, I want you to take an extra tablet. So you have a plan of what you have to do. You still have to ring and let the person know, because there might be something else going on that we need to bring you into the clinic for, to maybe to get bloods checked or your blood pressure or pulse rate checked to know what is actually causing those symptoms to occur. So this is part of your daily action. You do the daily weight, as I said, in the morning time, after you've gone to the toilet, before getting dressed, and write down what your weight is. You watch out then for an increase in weight of 2 kgs or 4 pounds over a 3 to 7 day period. A lot of the books and guidelines will be saying 3 days, but from in clinic and globally, what we've seen is that sometimes the weight can start increasing slowly, and that can happen especially if the doctor or the nurse reduces your water tablet, that your kidney function mightn't be as good, they've reduced down your water tablet. So if there's any adjustment to it, that's when you really have to start watching out for, is there an increase in my weight? The two things your heart don't like is that when you actually over push yourself, so you go over your limits. As I said, the heart works by emptying and by filling. So the heart rate has to be at a nice steady rate for it to fill properly, and then the strength of the heart muscle to pump forward. So if you're tired or getting overtired, your heart rate increases, so the filling is reduced, and that's when you're more at risk of holding on to fluid. So I advise that people, for 10 minutes every day, to have a rest. What studies have shown is that when you've got that rest, you needn't go to bed, but just to lie and sit in the chair, close the eyes for 10 minutes. And what happens is that the inside, everything begins to settle down, and the medication that we're taking actually works far better. So you get a far better achievement from your medications and where you can get to if you didn't actually take that rest. Another time to watch out for weight increase and weight rise is when you're not well. When you've got a chest infection or any kind of infection, your body starts to fight off the infection, starts raising heart rate and can start raising blood pressure, and the filling is reduced again. So that's another vital time to start closely monitoring your weight, that you're not holding on to fluid. The next thing is about taking your medication every day. I think that what I've seen is that when the prescriptions from the hospital, when they go to the chemist, it's usually like once a day or twice a day. And I'd really like you even to ask the chemist or to ask your heart failure nurse when you go back into clinic, am I taking my tablets at the right time? It's of huge importance. Like, for example, digoxin. I don't know if anybody's taking digoxin, or lanoxin is the other name. That has to be taken at nighttime. Not that it works any better at nighttime, it's because of blood level taking. We'll be looking for blood levels that has to be at a certain value that we know then you're getting maximum benefit from that tablet. We don't want a level too high or too low, but the blood test has to be taken 8 hours after you've taken that tablet. So if you take that lanoxin or digoxin in the morning and you go to the doctor then and get your bloods taken, it's going to be abnormally high, and that's what your medication will be titrated on. So digoxin is to be taken at nighttime. Cholesterol tablets take at nighttime. The reason for that is our bodies make cholesterol at nighttime. So in order to get the maximum benefit, you take your cholesterol tablets at nighttime. Aspirin, I usually recommend it to take it at nighttime, because aspirin sometimes interfere with other tablets, how well they work. So in order to get the maximum benefit from your tablets, just to take aspirin at nighttime. Food, some foods interact. People might be on things like warfarin. So it's very important that from the chemist or the pharmacist, there's little warfarin books that you can get, and that will actually tell you there's some foods that actually undo the job of your warfarin. So you want to make sure that you're not actually taking those foods. And as I said, health supplements. A lot of health supplements, like we'll say tonics, they've actually got extra supplements in them that increases heart rate. And what it actually means to do is meant to give you this kind of a feel of an extra little bit of energy. For anybody who doesn't have any difficulties with their heart pump, that's okay. That sensation of that extra bit of energy actually makes you feel well. But if your heart pump isn't working as well as normal, pushing increasing that heart rate will make it work less efficiently as a pump, and you don't want that. So that's why I'd like you to make sure you go to the same chemist all the time so that you can keep checking, is this okay to take with my medications? As I said, having the rest and also exercise. Exercise is of huge benefit. The benefits from exercise is just so vast. Is that I remember at a talk one time that the lecturer said that if you could put the benefits of exercise in a pill, that would be a multi-million dollar seller. That it keeps down body weight, it increases circulation, it increases your muscle tone, and if for the fats, it keeps those at a nice steady rate. It helps you to sleep better. Sitting is what they're saying is the new smoking. Sitting for long periods for any of us is actually very bad. If you're sitting for over an hour, it's actually the equivalent effect of smoking. All our blood and circulation gets more sluggish, and our fats in our bloods actually becomes abnormal. So I'd recommend anybody, I'd actually say that kind of every half hour to an hour to get up, even if it's only to go out to the next room and to come back in again, but not to be sitting for long periods of time. As I said, to rest when you're tired, and rest, have that extra rest during the day as well, even if it's only for 10 minutes. If you're doing something and you're beginning to feel tired, you stop and you rest for 10 minutes. If on a day you're feeling extra tired, I want you to look back and think, what was I at yesterday? Was I doing something yesterday that's actually too much for me? And that's how you begin to learn what your limitations are. And it's, I suppose, one, it's to accept these are my limitations. When you're feeling well, and I see it all the time, it's very hard when you feel well to think, why can't I do it too? But when you kind of push your heart too much, it's kind of counterproductive then. You don't stay as well as what you could if you had just kept within your limitations. And cardiac rehab, I'd like everybody to ask their GP or their nurse to know, have I got cardiac rehab available to me? And if I have cardiac rehab, could I be referred to it? It's an absolute excellent class. There's a cardiac physiologist there. They go as well as exercise. It's kind of like a little gym. There'd be exercise bike, walking on the spot, weights. It's a program that goes over a couple of weeks, but it's also a resource where you can ask questions. You learn how to keep yourself well, and you actually kind of learn where the confidence is about how much can I actually push myself. So those of you kind of wondering what exercise wise, what would be overdoing it, I think kind of like a rule of thumb would be when you're walking, not to be walking at a pace now where you're only just barely shuffling along. You have to be walking where you actually feel, gosh, I know now I'm exercising, but you're going at a pace where you can still hold a conversation. If you find it's hard to keep talking like that, then you know you're gone over your limit. So the heart is a muscle, so you want to exercise it, but yet not over push it. Exercise then will keep up the circulation all over the body and increase the muscle tone also, so that if you ever get sick, and you will because you're human, you'll get a cold or something, you'll tolerate it much better. Basically, it's like fitness. It's just slowly increasing your fitness level so that when you become ill, you can tolerate it better. For diet, in heart failure, we talk about salt, but I think we should talk about salt to everybody. Salt is absolutely every place. Every single one of us is consuming too much salt. If salt leads to high blood pressure, which is called hypertension, it's one of the highest drivers of it. And they say that if we could alone just control hypertension, some people would have a diagnosis of hypertension, but we say the values for the blood pressure isn't exactly within normal yet. And if we can actually get those values within normal, we could actually halve the rate of heart failure, which is huge. On the food packs nearly everywhere, there's little kind of like traffic light signs, so that they be green, orange and red. And you'd see them at the bottom of packs, and I think that's handy. So salt can be called salt or sodium. And if you look in the pack and if you see that that's in red, avoid it. There's too much salt in it. If it's in orange, be careful. And if it's in green, then that's okay. There's very little salt in it. So first and foremost, don't add salt to your food. There's already too much in it, and there's no salt replacements. That low salt, they've got a supplement in that called potassium, and if you're on medication, that can be very dangerous. So I don't advise low salt usage at all. With any other salt, like pink salt, Himalayan salt, or anything, salt is salt. So don't add salt to your food. Martin is very good, and I think he'll be later on in one of our meetings. Isn't that right, Lucinda, doing about cooking? And he's excellent at telling us about how we can use herbs to give nice different flavors. Salt gives that taste to food, and unfortunately for the first 2 weeks it tastes very bland, but the taste buds in our tongue changes. So after about 2 weeks we begin to taste the food for what it is itself, so that craving for salt then goes. And just to give you an example, one slice of bread from the loaf pan, be it white or brown, is actually 1/5 of our salt allowance for any of us in the day. And that's huge. It just doesn't taste salty at all. Anything in a packet or in a tin, anything that can last for months can usually only do that because of salt. So be careful of anything, any preservatives, any processed food. A portion of tomato ketchup or a portion of mayonnaise is actually the equivalent of a packet of crisps. Tin soup, or the packets, the packets that you'd mix with the hot water, they're actually 50% salt. So just be very careful and be mindful of how much you're actually consuming. For the heart failure person, salt actually holds on to fluid. It kind of sucks it in. So that will increase the fluid in your body. Your water tablets that you take, they work by reducing the salt in your blood. So if you start putting salt back into you're basically undoing the work of your water tablet. And what will happen is that your doctor or nurse will start increasing your water tablet. And the water tablet is the vein of everybody's life. It's not a nice medication to take. So if you only ensure that you could be on the least amount possible, and that can be some way achieved by ensuring that you're on a low salt diet by avoiding heavy salty foods. So as I said, anything processed in a tin or in a package, then cakes and biscuits, and it's back to basics. It's back to basically what we do, like what we know. Fresh and frozen vegetables, they've got the same nutrition content, so that it's hard to keep fresh vegetables before they go off going stale. So use frozen vegetables and use fresh meat. And just know about the volume of fluid that you're taking. I think what's handy to know, sometimes it's hard to know how much am I taking. There's actually too little and too much. You'd want to be drinking at least 1 litre of a day. Nobody, unless they're actually having problems with their fluid retention, should actually have to be on fluid restriction. I wouldn't recommend going over 2.5 litres, because your heart is like a pump. And if you start pouring large amounts into it, well then that's under pressure trying to deal with that amount of fluid. What I recommend is that for one day to get a measuring jug and actually measure how much fluid, that should be the tea, the coffee, the water, the wine, the 7-Up. How much fluid do I drink in a day? Because your tablets need fluid to work as well, but you don't want to underdo it. So you need at least 1 litre, and you don't want to overdo it either. And as I have a little picture up there and I'm looking at the wine and stuff, just be mindful that alcohol is actually toxic to the heart. It doesn't affect us all in the same way, but that it can make our heart rate increase. And so it makes our heart muscle then work harder. If you've had a couple of drinks and that you notice the next day that your weight has gone up, maybe you're one of these people that's more sensitive, and that would be best to avoid then only on seldom occasions to have it. The next thing then is body weight, just ensuring that we're keeping within a healthy body weight. I think this would be kind of like a savings account. As we said, we have a dietitian now with us in Waterford, and I'm actually learning loads from her. When somebody makes big changes to your diet, and we've all tried to be on diets and do different things. It's very hard to stick to it, and that we all like our little treats, and we're all human as well. And what she's recommending everybody to do, and I thought that was a fantastic idea, is to slowly start reducing your portions. And maybe that the portion is just too big, so that maybe instead of having 3 potatoes, that you'll go down to 2 for a couple of weeks, and then you slowly go down to 1, and just keep skimming the amount of portion that you're eating until that you're actually maintaining a healthy body weight. We've got some treatments in heart failure, and that if your BMI is over 30, then that maybe those treatments wouldn't be an option. And I think we like using these resources. I'd like to have everything available for everybody. So in order to have all treatments available, ensure that your BMI is less than 30, and if possible, get it down to normal. And the next time that you're in with your GP, like a chap asked today, he wants to know, what should I be at for my height? And we were able to tell him that. So the GP or the practice nurse should be able to help you with that, to calculate out what is your healthy body weight for you. As I said earlier, the flu vaccine is of huge importance this year. They're saying now that if you get the flu with the COVID, it could be very detrimental and very dangerous. So this is a vaccine that hopefully will be available next week or the week after. There's going to be a gang rush for it. So I'd start asking everybody to start making your appointments now, and encourage your family to get it as well. It's been given to children. I'm getting my child, and I'm also getting my sister's children, my brother's children, to actually get it this year. And because there's going to be a huge volume of people wanting it, the slots might get used up. So I'd hate to think that people were kind of going into early December and they still hadn't got their flu vaccine. The chemists actually give out the flu vaccine as well, but I know of my own family going online and getting slots with the chemist, they're actually filling up quite quickly. It's free to people who are at high risk, and it's also free to their families, so avail of it. People then who are in relationships, just to touch on about sexual activity, I think it's a subject that we seem to kind of avoid a little bit in Ireland, but that a very high proportion of people report sexual problems, and that can be down to simple things like medication, simple things that could actually be easily corrected, but you just have to tell us. You just have to tell us, and that's what we're there for. We're there to help you keep well and to live well as best as possible. When people are after having maybe a heart attack, that they might be often wondering, when am I able to have sexual activity back with my partner again? And just as the rule of thumb, like the exercise, when you're able to go up 3 flights of stairs, do general housework or do gardening, and it's not causing you any difficulties, then it is usually safe enough that you can resume with sexual activity again. I didn't know whether to put in this slide or take it out and to upset everybody. But please God, when we'll get back to being able to travel, is that knowing about going on holidays with heart failure. As I said, keep moving. When you'll eventually get on the plane, just don't be sitting for that long period of time. Get up, get moving. What's really important is, before you go on holidays anywhere, even in Ireland, get your GP or your cardiologist to give you a letter about your health history, about what medications you're on, your health history, who the name of your GP is, who the name of your cardiologist is, because and the person you're going with or traveling with, that they know where you have this letter, so that if you ever become very unwell, and we all know it's very hard to remember things when we're in a panic, and when you go into a hospital and they want to know what's been going on so they can treat you quickly and the best way possible, there's nothing more fabulous than having this letter ready, so that they're not actually trying to figure out what's going on or giving you medications that actually doesn't or mightn't suit you. Dress for the weather. If it's being too hot or too cold this evening, God, this week alone it was like that. Monday was glorious and today is absolutely freezing. When you go out, just be careful of the diet. When you go out and you eat in restaurants, and which is a lovely, very sociable thing to do, be conscious that they do add salt to the food, even that you might ask, I just don't want low salt in my diet. There will be salt, so that if your weight does go up the next day, you know then it's probably and could be more than likely something that I ate the evening before. As the salt content is washed out of your system, your weight should start to go down. Only become concerned about it if the weight stays up or keep rising, then to let us know. Otherwise, it's probably linked to what you probably ate. Things like Chinese food is very high in salt intake. Plan ahead, and there's nothing like having a plan of if who to contact if you become sick, where your letters are. If you're going, make sure you've got extra medication with you. Make sure your extra medication and your medication is in your hand luggage and not in a bag that's gone in a plane, and that might end up being transported, unfortunately, to some other country. So keep important things in your personal self going on, having the proper travel insurance, and to carry your ID card. In the airplane, just to be aware that it's to do really with financial reasons, but the oxygen in the air cabins gets reduced. It goes from 95 down to 92%, and that's okay for people who don't have any issues with breathing difficulties. But people who do, that little drop in oxygen might actually make you feel breathless. So that you can get oxygen ordered for the plane. This is free. And it's very simple to order. And I always think, like Murphy's Law, if you have it, you'll never need it. It's when you don't have it, you'll be looking for it. And if you don't have it ordered and require it, it can become a little awkward and more difficult then. What you do if you need to get oxygen is you ring the airline. They send you out a form. We mark the form and stamp it and basically say, yes, you are somebody who genuinely would need oxygen. They need at least 1 week's notice, and I said this is all free, simple 1-page form to fill out. So anybody with an NYHA class, so one is that you've got no symptoms of any heart failure, no breathlessness, no fatigue, no ankle swelling, your weight is stable. 2 is you're getting symptoms of breathlessness, but that you're breathless, but you don't have to stop. You just feel a little puffed. 3 then is that you're breathless and you're having to stop. Those people who get breathless and have to stop definitely need the oxygen when flying, and safe to fly for up to 7 hours. If you have an episode of having fluid build up in the body, you shouldn't fly then for 6 weeks. And as I said, I think that the use of the resources is just a real huge importance. The Irish Heart Foundation, to click onto these for the Heart Failure Matters is another excellent resource as well. And use everything around you. Lucinda will be able to tell us now if that the people who are joining the support, if the counselling sessions are still available. They are?
Yeah, they are. Yeah.
So that we have to treat our body as the whole. Our mind, to keep it healthy, is also very important. It's when you're worrying and when the worrying becomes over what you can manage, and that's a sign of that is you mightn't be sleeping well. You'll be, this constant thought is in your mind. Then the counselling through the Irish Heart Foundation, they teach you how to manage those thoughts, and that's of huge importance. Sleeping and being able to sleep well is also fierce important in keeping healthy. Another important part of heart health is actually looking after your dental health as well, making sure that you go to the dentist. If our dental health isn't good, there could be bacteria build up in our teeth and in our gums, and that can actually go back down into the valves of our heart and actually damage or affect them greatly. Or it can cause an infection around the heart as well. So that getting a regular checkup with the dentist is also another way of keeping your heart healthy. So it's by pushing, so the heart, this picture is the jigsaw. It's by putting everything together is how you're going to keep yourself well and as best as possible. It's not just doing one thing. So it's not just taking your medication and not doing anything else. It's taking the medication, the exercise, knowing your limits, having your rest, eating healthy, maintaining healthy body weight, what else? And getting your flu vaccine for this year. So your life plan. Success all depends on the second letter, and that's back to you. So that's it for me. I hope this was of benefit to you. And as I said, it mightn't be today, mightn't be tomorrow, but it might be some other time that you're wondering about anything. You can ask about medication. I'm very willing to answer any questions you have. You just send on your questions to Lucinda, and I'm here as a resource, and I'm very happy for you